Hi, South Texas. It is great to be with you again for this edition of the South Texas News. Well, it's official. Fiscal year 2020 is over. Now, it has been a challenging year. I can say that it has challenged all of us as individuals, and it's definitely challenged us as a healthcare system more than I think any of us could have expected or imagined. But I'm also proud to say that as a healthcare system and as individuals, we've exceeded all of our expectations, not just of ourselves, but the expectations of Vision 17, the expectations of the Department of Veterans Affairs, and definitely the expectations of the Texas healthcare community. We'll start with your COVID-19 response. Your efforts were amazing. During the COVID-19 pandemic, we cared for over 2,000 COVID-positive veterans and nearly 30 COVID-positive civilians under VA's fourth mission. And because of your efforts, we've been able to keep not just those veterans and civilians safe, but return the majority of them to their families who have sent many letters and emails of thanks for the care and services that you provided to their loved ones. And for that, I thank you personally. We've also managed to sustain access to our healthcare system. As you know, VA is the national leader in telehealth, and using that platform, we were able to continue providing care to many of the 100,000 veterans that we serve that would typically like to come in for a face-to-face evaluation, but using our virtual health modalities like VA Video Connect, in some cases telephone visits, or clinical video telehealth, we were able to provide the services that they needed. We also had tremendous recruitment success during the COVID-19 pandemic, hiring hundreds of American civilians to come in and help us care for our veterans when many of them were facing unemployment during a significant economic downturn. So thank you to our hiring managers and human resources. We've continued to see clinical quality improvements, particularly in hospital-based sale and CMS nursing home compare, where we continue to have 4- and 5-star facilities. Last but definitely not least, we saw our high reliability journey continue with our quality, safety, and experience forums. We saw joint patient safety reporting at record numbers, particularly with close calls, and we continue to see upward trends in our experience scores, especially in V-signals, where veterans are telling us that they trust VA to provide the care and services that they need at levels that we've never seen before. So thank you for that. But as we said, October 1st marked the start of 2021, and it's going to be an exciting year for the South Texas Veterans Healthcare System. But we're going to continue with the transformation that we've begun. Now, I want you to think of 2021 as the year of building for our healthcare system, and here's what that means. Now, that means we're going to continue to build a safer healthcare system. I briefly talked to you about our high reliability journey and the things that we started in fiscal year 20. Those are going to continue in fiscal year 2021, and with your input, they will continue to be successful. With our quality, safety, and experience forums, we've had a lot of input from our staff, and we just ask for that engagement from each of you to continue. We're also going to build a more accessible healthcare system. I told you that we provided record amounts of telehealth at the heights of the COVID-19 pandemic, but at the same time, we've got some work that we need to catch up on. So that's going to be more scheduling of appointments, more surgeries in the operating room, and I want you to help us continue to make South Texas the most accessible healthcare system in our region. But we're also going to build a larger healthcare system from our new outpatient location at the Balcones Heights Mall to our largest ambulatory care center, what we're calling the Northwest Healthcare Center, that we expect to open between July and September of calendar year 21. And last but definitely not least, we're going to continue to build a more compassionate healthcare system. I'm so impressed with the efforts of our Chief Experience Officer and the Organizational Experience Service and all of our staff engaging in our commitment to being a more compassionate healthcare system and creating an unmatched experience, not just for the veterans that we serve, but for the employees that we have the honor of having on our payroll. So it's going to be a great year for the South Texas Veterans Healthcare System, and I look forward to seeing you through with each and every one of you. Now, following my video, you'll see others through the course of the next week from other members of the senior leadership team, and they'll be talking to you about the amazing work that's happened and those services that report to them, and those things that you can also expect to see in fiscal year 2021. Look forward to talking to you, South Texas. We'll see you next time.